Hey everybody, how's it going? I hope you're doing well and your studies are going smoothly. Welcome back. It's time to revise. We're going to be doing psychopathology today, and it's the cognitive approach to treating depression, also known as CBT. All right, let's do this. So here are some exam style questions. You know the drill. Press pause to practice. Give it a go. Come back, and then I'll talk through my thoughts on tackling them. Okay, right, let's crack on. Identify an emotional characteristic. Well, the key one to go for is a persistent low mood. Yeah, don't just say feeling depressed. But another common one is anger or frustration, so that would be okay as well. Now we need to outline a behavioural characteristic. So, not just identify. A common behavioural characteristic is what is called avolition, which is a lack of motivation. Okay. So just to expand on that a little bit for that second mark, you could say, for example, a person with depression might struggle to get out of bed in the morning, or to initiate some kind of task, or to engage in, personal care routines, that sort of thing, okay? So it's a lack of motivation, avolition. Okay, other ones that you could mention just while we're there, actually, things like a change to eating behavior, changes to sleep routine, changes to activity levels. Yeah, so any of that could go up or down. But the key thing being it's a behavior, so it's something that you would see as opposed to a feeling or thinking. Okay, outline a strategy used in CBT. There are several, the key one probably being disputing, if you listen to Albert Ellis. So vigorous argument of the irrational thoughts or irrational beliefs that are happening in the person with depression. Yeah, that can be done empirically, so based on evidence, or logically, or pragmatically, so how practical is that belief, how helpful is it? So that's disputing. You could talk about behavioral activation, which is where you try to encourage the client to engage again in some of the behaviors or hobbies or activities that they used to do. And the hope there is that actually, we know things like exercise are really beneficial for depression. You've got the release of endorphins and all of that. It's a good kind of feel-good way of getting someone back on track. So you've got behavioural activation, you've got disputing. If we go down the route of what Beck would do in his CBT, you could use patient as scientist or client as scientist, which is where you would set the client maybe homework tasks, maybe keeping a diary, that sort of thing, basically to collect evidence to then bring back to the discussion, and you can use that to pick apart some of those beliefs and hopefully support the therapist in breaking down those beliefs or challenging them, disputing them. Okay, so there's a few different ones there. Unconditional positive regard is another one you might see, so trying to treat the patient with respect and empathy and make them feel heard and break down some of the what you call conditions of worth that they might have developed. So kind of feeling that they're only valued if they do what other people want, or they don't have any kind of self-value, off their own back kind of thing. Yeah, so unconditional positive regard, you could say as well. We've then got a little scenario, and if you've seen the other, the explanations video, then you've seen this Seb one already, but this one here, the focus is on treatment. So how could CBT help? Well, what you need to do basically is to talk through some of those strategies. Yeah, so what you're going to do, CBT is going to identify, challenge and replace the negative thinking, such as Seb feels, there's little point in putting himself out there. He feels that he's unlovable. He feels that maybe the future is not good. Other people don't treat him fairly. So you're going to identify those beliefs, you're going to challenge them and replace them with more effective and positive beliefs. How are we going to do that? Well, you could talk about disputing. Yeah, so maybe he could, the therapist could dispute the belief that no one will ever love him, maybe using evidence, and that's where maybe the patient as scientist or the client as scientist is going to come in. So perhaps the therapist could give Seb some homework activities or ask Seb to keep a diary of different interactions that he has with people, recording positives and negatives, but ideally looking for positives. And Seb could then bring those back to the next CBT session and discuss those and hopefully use them to challenge some of those beliefs. Yeah, so we've talked about disputing and client as scientist there. There isn't necessarily anything there that suggests behavioural activation. I mean, it says he refuses to go out, so maybe you could work that in. But either way, you could get some knowledge definitely there. Perhaps the behavioural activation could be actually just going out and doing a social activity with friends. So yeah, maybe you could work that one in as well. Unconditional positive regard. Seb is feeling very low. He's feeling very bad about himself in terms of his self-image. So yeah, the therapist could also provide unconditional positive regard and empathy and respect. That might help. Okay, so for 6 marks, I would just pick maybe 3 strategies to apply to Seb and start that response off with a little bit of a, CBT is a cognitive approach that tries to identify, challenge and replace negative thinking. So just a bit of an overview first. Okay, so outlining, we've covered a lot of this already, but you're going to start off with this idea of it's a treatment whereby we identify, challenge and replace negative thinking. It's a talking therapy. And then just talk through some of those strategies that we've already mentioned, okay? You're just going to give a little bit more depth here because it's 6 knowledge marks, whereas in the previous one, it was only 3 knowledge marks as part of that application. Okay, explain one strength of CBT. You could go down the research-based route. So Ellis claimed that his version of CBT, or REBD, was 90% effective. Well, this supports the credibility of CBT. You could do that. You could talk about the benefits to patients and therefore on the economy. You could talk about how it gets people to, it equips them with strategies to manage their own mental health, which will hopefully in the long run enable them to get back into work or to stay in work and be more productive for the economy in terms of taking less time off, so less cost to business, less absenteeism, more productivity, more goods and services being provided by those companies, hopefully. So you could go down that route. You could argue that maybe it's more ethical than something like drug therapy. So, it puts the power and the responsibility back on the client, back on the patient. Yeah, so it's quite empowering for them as opposed to, oh, you've got something biologically wrong. Here, take this drug, which is a very kind of passive way of dealing with a condition. Has its own benefits, of course, but CBT is often seen as a bit more, as I said, kind of empowering for clients to engage with. Okay, so to explain a strength, we don't really want to counterpoint that. It's just going to be a point, explain, conclude kind of thing. Okay. All right, so we've then got discuss one limitation. So here is where, because it says discuss, we're going to want to explain a limitation and then kind of counter-argue and develop that point a bit, okay? So possibly a limitation is that it requires lots of sessions or that it costs lots of money, either or. You could kind of use both together because time is money, don't forget. The issue there is maybe, again, the impact on the economy because it costs a lot of money, burden on the NHS in terms of funding it. It requires specialist training of therapists. It requires patients to actually take time off work if they're in work already to go and attend those sessions. So you could, explain that as a limitation. There's lots of things going on there. And to discuss that, you could develop that by saying, okay, fine, it does cost money, but in the long run, actually, as we said, we're equipping people with strategies to manage their depression for themselves. And eventually, maybe after 5, 10, 20 sessions, they won't need those sessions anymore. And that cost stops. Yeah. Whereas with drug therapy, it might be that they have to take those drugs for years and years and years. And in the long run, drug therapy actually costs more money on, for example, the NHS. So you could do that. Okay. Another idea for discussing a limitation. Well, a limitation could be that maybe it's not accessible or appropriate for all patients. If you've got someone that's really struggling with, coming out of the house, maybe avolition, things like this, then they're not going to be able to turn up to an appointment and engage in the reflection and the discussion and the, active nature of CBT. So that makes it not appropriate. But then the counterpoint to that, the further discussion could be actually, you can run CBT sessions online nowadays, particularly since the pandemic. There's a lot of resource now there for running online CBT or over the phone CBT. There are self-help kind of independent versions that you can do. So even though it's maybe not possible for everybody to get out and go to an appointment, and that probably is the most effective way of doing it, if we're honest about it. For some people where that's not possible, you can get around it using these other kind of modalities for CBT, these other kind of more accessible routes. Yeah. Okay, we're then on to an 8 marker. Describe and evaluate. We're probably looking at a 4+4 here. So in terms of knowledge, we've been through this already. CBT is a talking therapy that aims to identify, challenge and replace negative thinking in depression patients. You can talk through some of those strategies. In terms of the evaluation, for those 4 marks, I'd be looking probably for 2 points, maybe one strength, one limitation. Or it could be one, like we've just done, that discussion-based one, where you take 1 point, discuss the counter-argument, develop it, bring it together at the end of that paragraph. And that would be fine for 4 marks. Remember that these are level, these bigger questions, and you're looking for your knowledge to be full of specialist terminology, detailed, accurate, a coherent answer, and your evaluation should be thorough and effective. So if you can discuss and introduce some elaboration and counterpoints, that'll be great. We've then got a 16 marker to finish things off. So it's going to be very similar in the approach to the 8 marker we just talked about, but a little more knowledge. So you've got 6 knowledge marks there in that 16 marker, and then 10 evaluation marks. So flexing that up from 4, we're kind of maybe aiming for 3 discussion paragraphs, or maybe 4 if they're not quite all fully developed. But we talked about loads of points already. So talk about the economics of it, for and against. Yes, long-term cost. Short-term cost, but long-term saving money compared to something like drugs. Talk about, is it appropriate? Is it accessible? Yeah, we've had that 2-sided discussion a couple of minutes ago. Talk about the fact that it's supported by research. Yeah, over 90% effective according to Ellis. Yeah, not all research finds that. We're probably looking more at 75 to 80%. Yeah, and some studies have suggested that actually the best way of treating depression is using CBT alongside, for example, a drug therapy. And it might be that the drug therapy deals with, enough of the symptoms, or it takes the edge off some of their thinking and avolition so that they can then engage better with the CBT. Yeah, so you could have a discussion about maybe a more holistic approach being needed to treating depression. Yeah, combination therapy. Okay. So we've talked briefly about some characteristics. We've talked about some of the strategies involved. We've applied it. Yeah, and then we went on to talk about strengths and limitations and how we could then shape that up into being a longer response or even a 16 marker. So how did that go for you? What happened? Why did that happen? How was it time-wise? Did you have to have a cheeky look-up of anything? Make a note of it. Feed it back into your future actions and revision. Yeah, what are you going to do next? Okay, thanks very much, guys. I hope that was useful for you. Do feel free to ask a question in the comments. Keep it up, yeah? You got this. Bish bash bosh.